Brookfield Traffic Center. Marcus Allen.
It's a mobile traffic center
It
this
is.
morning.
It's mobile.
So as you get going this morning, there is a disabled vehicle westbound 94 at Highway 100. It is out of traffic, but a little slow as you head west out of the Zoo interchange. And things are just starting to get slow as you work your way through the bypass and that construction. Westbound delays run from Loomis out to 84th. Traffic is brought to you by Semperfi Roofing and Exteriors, your local veteran-owned and operated exterior remodeling company. For your new roof siding, window, and door installation or masonry work, they go beyond the call of duty, and you can find them at semperfiroofing.com. I'm Marcus Allen with WKLH Hometown Traffic.
Your Weather Watch 12 forecast. It's sunny now. We may see some showers and thunderstorms this afternoon. We'll get to a high of 73. It's 45. I'm Doreen Michaels.
You know the phrase, you get what you pay for. It's not just a cliche, it's true. Even here, especially here, the wraparound care, the expert medical teams, the experience that the families have here at Children's, well, that all costs money. And guess what? A substantial portion of that care is not covered by insurance. It's covered by you and me and everyone who donates. And that's the reason we do the Miracle Marathon. And joining us right now is Dr. Reiner Gedeit. Dr. Gedeit is the Chief Medical Officer and Pediatric Critical Care Physician here at Children's, Wisconsin. Dr. Gedeit, thank you for joining us. How you doing?
I'm doing great this morning. Thanks for having me here today.
Yeah.
This is really great.
You've been here since 1990.
Right.
That's when you started. Now, explain to the people who are listening how this place has grown, not in terms of the actual facility.
Right.
We've all seen that, but in terms of staff. How big is the staff now?
Oh well, the medical caregivers, the physicians here have grown immensely. I mean, when I came here as a member of the Department of Pediatrics at the medical college, we had around 60 pediatric specialists here to care for children, and that number is now well over 300.
Wow.
And totally right now we have between physicians and advanced practice providers, we have well over 800 providers giving care for children here.
Now, that's 800 providers in a facility that has 6,500 plus employees as well. So that's a pretty impressive number.
Yeah.
Yeah, I liked how you said when we were talking about like your role here in the day in the life of what happens at Children's, that it's not just the healthcare. It's not like we bandage up and send you home. It's not just healthcare, it's whole care. Like wrapping your arms around just not what happens here, but what happens after the child leaves here. So take us through a little bit of that.
Yeah, well, I think that's the most important piece that we really have here is not only, as you said, not only doing the medical care here, but doing the care out in the community. The things that we do to support our patients out there. I think a great example is our Project Ujima, which supports children and families after they've been victims of violence. And we do everything from summer camps to mentoring to helping families get the basic needs of food, housing, jobs, so they will not become victims of violence again and also will not retaliate with violence, which is really very, very important. And I believe we had around 15,000 touch points with Project Ujima.
And that's just one thing. That Project Ujima is just one
Right.
thing that you guys do. I mean, when you talk about wraparound care, you're not just talking about each individual child that comes through the doors here. You're talking about wrapping the care around the kids in our community. For example, the school nursing program, other things like that. Those are funded by and run by Children's, and that's the kind of stuff that philanthropy funds, which is why we do this Miracle Marathon.
Absolutely, and that's so very important. We care for, see 4,000 kids in 11 Milwaukee public schools, and there, again, school nurses will see around 14,000 touch points with kids in those schools. So again, that's something that we know. We know kids need to be healthy in order to learn. And so we need to have those school nurses there to really make sure the kids get the best possible care they can.
What are some of the other things that Children's is involved in the community?
Oh wow, so we have our positive parenting program, which is a support for families because we know we need to have good, healthy families and to have good, healthy children. And with that positive parenting program, we've had nearly 400 caregivers complete that training, and it really helps everything from how to do bedtime routines to how to work with an adolescent and looking at screen time, how to do those things safely. And right now we've had our first online training with that, and so right now there'll be online classes starting next month, and again, to strengthen the parenting skills and really, really giving families tips on how to raise healthy children and how to keep the families healthy as well.
So you got Project Ujima, the school nurses, you've got
The positive parents, what about the
Positive parents.
foster care and adoption? That's unique to
that's
this.
very unique, yeah.
Yeah, that's something that, you really don't see children's, healthcare organizations doing, and I think we are the largest provider of foster programming in the state of Wisconsin. And we really have about 1,000 kids and families being supported with adoption and foster care. And again, in that way, we can make sure the kids are getting health care. Those kids are going into foster care, get physical examinations, get health care before going into foster care and when they're in foster care. And again, those adoption services to help families really take good care of their kids. So it's something that's very, very unique, but something that is so very, very important for the entire family.
And also the mental health.
I was just going to bring that up. And those statistics that Doreen and I were privy to are shocking.
They
The
are.
statistics of the mental health, the decline of our youth, and how many suicides and attempted suicides there are. And I know Children's has got a huge effort going on right now to try to identify those kids and help those kids early on.
Yeah, no, that is so very, very important, and I think as you're saying, during the pandemic, we kind of seen a worsening of the mental health for our children and adolescents. And I think again, the most incredible thing we've done is put mental health care providers in our primary care clinics. So those pediatricians who identify issues can refer them right to a counselor right there in their clinic. And the touch points there are pretty incredible. And having gone out to visit one of the clinics a few weeks ago and talking with the physicians, the pediatricians out there, they said, 3-4 years ago, they'd identify something and then refer to a say, well, you've got to go get some mental health, find a mental health provider, and they couldn't find anybody for 6 months, 12 months, and they didn't know what to do.
Right, and this is the thing where you got to try to, there's got to be intervention quickly.
Yep.
Immediately.
And so we can have the pediatricians right there refer them to the counselor who's right there in the clinic, and the kids can come back and see that person multiple times in order to really get the care they need.
And it can be life-saving.
And for people at home that are listening to this, you got to know that since they started doing this, the percentage of kids who have either harmed themselves or are thinking of harming themselves is shockingly high. And had that intervention not taken place, or but prior to this wasn't taking place, now that it is, they can immediately step in and get them the help that they need.
Absolutely, absolutely. And we've seen in the pediatrician's office, there's almost 34,000 touch points with mental health providers in the last year. So it's pretty incredible.
The whole facility is very impressive, and what Children's Wisconsin does is really beyond compare. And that's substantiated by, U.S. News and World Report, once again, has got Children's Wisconsin right toward the top of the list in so many different categories. We're very lucky and fortunate to have it here. I would imagine in your position and your capacity here, no day is exactly the same.
No, every day's different. You never know what's going to come through the door as far as patients or situations, but that's what makes it exciting, to see and then be able to have the resources we have in order to care for the kids, whether it's in the emergency room where we see, anywhere between probably 220 and 270 patients a day, or
Think about that, 270 patients a day in the emergency room.
Well, and all the training that's required for the trauma and emergencies and surgeries, and it's mind-boggling.
Yes, no, I think we've got a wonderful staff there, wonderful staff in the ER, wonderful staff in the hospital, everywhere. And again, the training that we do for we see nursing students, pharmacy students, medical students. We train, respiratory therapists, and so I think training the people in order to care for children is also very, very important. So we train our medical specialists, our surgical specialists here in order to hopefully keep them here because we want them and we need them to care for the kids here.
And I think that's worth noting as well, that Children's Wisconsin is aspirational for many young people who are getting into the medical field, who are becoming doctors, nurses, other caregivers. They aspire to come here. This is that kind of a facility. And frankly, let's be honest, free agents don't always want to come to Milwaukee, Wisconsin. But they do in the medical field because of Children's.
Well, and a lot of them were patients themselves.
Yeah, they were.
Yep.
You're right about
Yep.
that.
And also you talk about the training, and that's why I'm here.
Mhm.
I came, I'm a Chicagoan. I'm one of those original. I'm still a Bears fan.
We
so don't
forgive
hold it
you.
against
That's
me.
okay, we won't hold it
forgive
against
you.
you.
So,
Yeah.
I came up here in 1990 to do my training in pediatric critical care medicine, and my intent was to be here for 3 years and leave.
Right,
And that's 35 years ago.
Yeah.
right.
So
Well, we're glad you're here.
An incredible place to be, an incredible place to work. And again, thank you for all the support that you and your listeners have given over the years. Again, as you said, we can't do it without the support of the community. The community is just incredible here, and the 26 years that you've done this to help us do what we need to do for children has just been incredible. From those days down in the basement, in the
Right,
cafeteria.
when we started, we were down in the
to,
cafeteria,
to
yeah.
where we are now, and all the support that you drum up for us is just incredible.
Well, it's our
So thank
audience
you.
that steps up, and we're very proud of our
Yeah.
listeners. We really are. I mean, they're the ones that prioritize this, and they should.
Mhm.
They should, and they get that. They understand that. It blows my mind that when it comes to charitable donations, a lot of people don't even think to donate to Children's
Right,
Wisconsin.
they think it's a hospital, they have money.
They think the insurance company's
Yep.
going to cover everything, and that's just not the case. So much of what you guys do is not covered by insurance. And when families come in and speak to the wraparound care, they're speaking to things that were funded by our listeners, among others, of course.
Sure.
But the bottom line is that's why we do this, because we can see with our very own eyes that your money that you're donating to Children's makes a palpable difference. And we talk to the families and the caregivers who tell us that that money not only stays here in Wisconsin, but immediately goes to good use. So please make the phones ring. Dr. Gedeit, thank you so much. We appreciate it.
Well, thank you very much, and again, thank you very much, and thank you to the community for all the support.
Make these phones ring.
414-337-9554. Text MIRACLE. Text the word MIRACLE to 414-799-1965. Or you can go to our website, WKLH.com.
We have more Miracle Marathon coming up on KLH.